Hello, I'm Dr. George Ampat. I work as an orthopedic consultant in Liverpool. I'm also a clinical teacher in the School of Medicine. Reflection is something we unconsciously perform on a day-to-day basis. We think and analyze every experience that we go through and then decide on how to act better if the situation arises again. A formal system to reflect would allow us to progress through the stages in a methodical way and not to miss any vital steps. Graham Gibbs from the University of Huddersfield developed the Gibbs Reflective Cycle in 1988. There are 6 steps in the Gibbs model. They are 1. Description, 2. Feelings, 3. Evaluation, 4. Analysis, 5. Conclusion, and 6. Action plan. Let me go through each one of them to make it easier. I will enumerate questions that need to be answered for each step. Answering the questions will enable you to progress through the 6 steps. You don't need to answer all the questions in each step. The questions are just a way to identify what specific details need to be included in that step. Description. This involves enumerating all the events that occurred. The questions that can be helpful in this step are: what happened? When did it happen? Where did it happen? Who was present when it happened? What did each one do when it happened? The next one is feelings. This involves listing the thoughts that you had whilst going through the experience. The questions that can be helpful in this step are: what did I feel before, during, and after the event? What did others feel before, during, and after the event? What were you thinking before, during, and after the event? What were others thinking before, during, and after the event? The next step is evaluation. This involves documenting what went well and what did not go well. The questions that can be helpful in this step are: what went well and what did not go well? What were the positive and negative contributions by you and by the others? The next step is analysis. The initial 3 steps involve the factual details that occurred during the experience. It is from this step that we are trying to learn from the experience. The analysis step involves looking at the events that occurred and interpreting why some things went well and why some things did not go well. This may also involve some further research and study. We may need to search the literature and even identify courses to improve ourselves. We may need to discuss with our colleagues to identify how we could do better. The questions that can be helpful in this step are: why did it go well? Why did it not go well? What can I do so that I or my team can do it better next time? Could I research on this subject? Could I study more? Could I attend a course? The next step is conclusion. In this step, we summarize our findings and determine the changes that needs to be made. The questions that can be helpful in this step are: what can I/we learn from the situation? What needs to be done differently next time? How can the situation be more positive for me and for others the next time? And finally comes the action plan. In this step, we come to a clear plan on how we can do better the next time the situation arises. It is important not only to make changes, but equally important to ensure that the changes are followed through. The questions that can be helpful in this step are: what steps do I take to do it differently next time? What skills do I need to acquire before the event happens again? How can I ensure I adhere to this action plan? So let us go through a scenario. A 23-year-old motorcyclist has been struck by a car on the motorway and is being brought to accident and emergency by ambulance. You are the junior doctor or the medical student in the accident and emergency. The trauma team is alerted, which includes different doctors, nurses, and other healthcare personnel. The patient is brought in, and each team member has a different role. There is a team leader who is not directly involved in the care but directs others. They identify that the patient has an open femoral fracture on the right thigh and no other injuries. He is stabilized, and the orthopedic team plans to take him to theatre for debridement and surgical stabilization. Now let us go through the cycle to reflect on your experience as a junior doctor or as a medical student. The first step, description. It was a trauma call. I observed as I was posted in accident emergency. It was a team activity. Each member of the team had a different skill and a specific role. There is a leader to the team. There is much activity. The second step, feelings. It was a stressful situation for me. Though there is much activity, the members of the team seem to be calm and carrying on with the task that they are assigned to. The third step, evaluation. The patient, though involved in a high-speed collision, has done well. He has been shifted from A&E to the theatre. The teamwork and the cooperation between the members of the team was clear. The need for the leader to stand outside and direct the individual members of the team seems to coordinate the work involved. The next step, analysis. It was an excellent teamwork. I was new, but have learned a lot. I will read up on the protocol for major trauma. I will discuss with the doctors and the nurses involved to understand what I could do better next time and how I could be part of the team. Then comes the conclusion, the fifth step. This is a stressful but thrilling experience. I can see how teamwork can make a big difference in patient outcomes. I also learned there is a course which I can attend and learn about major trauma. The course is called the ATLS course. The last step, the action plan. I talked to my educational supervisor and enroll myself on the next ATLS course. I sincerely hope that was helpful. Thank you very much.